Well, today we saw startling new evidence of the ravages of the pandemic in India. Now, it was already a dire situation, the government reporting more than 415,000 people have died. But most infectious disease experts agree the real toll is almost certainly much higher. Today, the Washington-based Center for Global Development released the most comprehensive study on the impact of the coronavirus in India. And as feared, it says India's death toll could be a staggering 10 times higher than the official tally. Now, that would mean 4.7 million additional deaths from the start of the pandemic until June of this year. And just a few months ago, India saw a devastating rise in infections driven largely by the more infectious Delta variant. Well, joining us now is one of the authors of that report. Abhishek Anand is a graduate of Harvard's Kennedy School, and he has worked as a policy analyst for the Indian government. He joins me tonight from Delhi. It's good to have you on the program. We knew that India's COVID-related deaths were higher than the official figures, but were you surprised? Were you shocked at what came out of your research? I mean, we're talking about nearly 5 million extra deaths.
Yeah, we were surprised, to be frank, because primarily because people have been talking about second wave, which we had in India, which lasted from around May to late June. And people knew that the official estimates were quite an undercount. But what was surprising for us that even in the first wave, which started in around, say, April and went on till around August, September, the number of deaths that we finally found based on our different estimates was very, very high. So it was very surprising for us.
And Mr. Anand, what you've described in your report, I mean, it could be India's worst human tragedy in modern times. I mean, we want to let that sink in for a moment. In modern times. What has been the response there to this possibility?
Unfortunately, I think we are still lacking in response in terms of policy as well as targeting people, reaching out to people who have actually suffered. So first of all, what the government needs to do to accept the fact that there has been a lot more deaths than what is commonly believed, because only once you accept it, you can have targeted intervention. You can also prepare better for the future. And also maybe the vaccination drive should be much faster than what it is right now. So I just hope that in future, taking lessons from maybe what our results show, and also many other results are coming up now, hopefully government will be much more proactive, and also the policy response will be better than what it has been so far.
Well, talk to me about how difficult it was to gather this information. We're wondering why, official figures are always so far off in India when we're talking about the coronavirus.
So there are many reasons, in fact, why official numbers could be an undercount. One reason is in rural India, basically the infrastructure is not proper, the health infrastructure. So until unless somebody gets tested, gets admitted in hospital and gets treated, you never get to know whether a person died of COVID or any other issue. What we found in our study is that people earlier believed that it was much more of a city phenomenon, more in urban areas. But we see in our result that, equal number of people have been affected in rural areas as well. And because we can't really reach out to people in rural areas, they cannot get tested. So, obviously that leads to an undercount to such an extent.
Is it possible that the national government of Narendra Modi is trying to minimize the extent of the crisis with its lax approach to COVID-19 statistics? Is there an argument that you could make there that they're almost profiting from the fact that gathering statistics is so difficult?
To be fair, I think the problem is not just with this government. Given our infrastructure that we have in place, I think it would have been difficult for any other government. And generally, you are also right. Government would want to show a lower number. But I believe any other government would have found it difficult just because you cannot really test people. And in a pandemic year, it also takes time to come out with actual number, because death registry takes time, because now we are actually getting numbers. One of the methods that we rely on is basically using official deaths that have been registered. Now, because there was a prolonged lockdown, so it was difficult for people to come out and get their if there was any death in the family to get it registered. So hopefully with time, that delay that we have seen so far, that will not be the case. But let's see how it goes.
Okay. Abhishek, Anand, we appreciate your time and your insights tonight. We appreciate you staying up so late to talk with us. Thank you.
Thanks so much. Yeah.